I'm Dr. Om Ganda from the Joslin Diabetes Center and Harvard Medical School in Boston, Massachusetts, USA. It's really a pleasure to be here at the 17th World Congress of Cardiology as an invited speaker. I'm very thankful to Dr. Kimchi for extending this kind invitation for me to speak. I'm the director of the lipid clinic at the Joslin Diabetes Center, and tomorrow on Monday in the morning I'll be speaking about a study that we have done on looking at the discrepancy between the currently recommended goals of LDL cholesterol and non-HDL cholesterol and compare them with ApoB levels in patients with hypertriglyceridemia and diabetes. So according to the current guidelines, we are reminded that in patients with elevated triglyceride, we should not only look at LDL cholesterol, but we should also look at non-HDL cholesterol and decide when to intensify statin therapy to reach our goals. However, it is also known that ApoB is a much better indicator of lipoprotein particle number, which is not really quite equivalent to what we learned from looking at looking at non-HDL cholesterol. So there are some studies already that have been published that show that ApoB gives us more useful information compared to non-HDL cholesterol. But this is not yet part of the guidelines, and there remains quite a bit of controversy. In fact, the meta-analysis of lipid trials recently published has suggested that non-HDL cholesterol gives us the same information as ApoB levels do. However, those meta-analyses have one problem, and that is that they look at the total population level rather than individual levels. And what we're trying to show in our study is that at the individual level, there's a fair amount of discrepancy, so that non-HDL cholesterol can be high, and yet ApoB level may not be high in some patients, whereas the reverse is also true, that you could be in the goal for non-HDL cholesterol, yet the ApoB goal is yet not reached. In such patients, intensifying statin therapy to reach the ApoB goal would be more useful. This is not yet fully confirmed by ongoing clinical trials, yet we need to do more studies to show that ApoB measurement will be a supplemental way to reduce the cardiovascular risk that still persists in people who have been treated with statin even after a number of years. So I think that's part of the presentation where I would like to discuss the relative value of non-HDL cholesterol versus ApoB in patients, particularly with diabetes, who have high triglycerides in the range of 200 to 500, which is a fairly large number of patients with type 2 diabetes even after statin treatment.